Okay, our next speaker is Professor Haryana Dhillon. Haryana is a professor in psycho-oncology and the chair of the Psycho-Oncology Cooperative Research Group, or POCOG. She has more than 30 years' experience in cancer clinical research and is passionate about rigour in research, practical solutions to tricky problems, and doing what they can to help humans make it to the 22nd century. Haryana will talk to us today around the lessons from brains, where to with supportive care for people with brain tumours. Please welcome Haryana.
Thank you so much, Marina, and thanks for the invitation to be here. It's always fantastic to be part of this forum. And I'd like to say welcome to Karen and Sarah as well, and thank you for setting the scene so beautifully and highlighting the common issues that we have globally for people who are living with a brain tumour diagnosis. So, the BRAINS program, let me tell you what we've been doing and where we want to go from here. The BRAINS program was funded by the MRFF brain cancer mission, the Brain Cancer Survivorship Grant, and we're incredibly grateful to have had that funding to enable us to do this work, to really try and drive forward the support that's available for people who are living with brain tumour. Just wanted to acknowledge the traditional custodians of the lands on which we're meeting today, and also acknowledge that I live and work on Gadi land in Sydney, but I grew up in country New South Wales on Gamilaroi land, and so that forms very much part of my approach to understanding how to support people by working with communities across all of Australia, whether they're metropolitan or regional. And I also wanted to just take a moment to acknowledge how much effort you as patients and families put into the care and support that you provide to yourselves and the people that you care for. We in healthcare don't pay very much attention to that effort that all of you put in, but you are partners in this process, and I think it's always worth remembering that you are at the centre of it and acknowledging the effort that you put in. So I just also wanted to kind of take a brief look at some of the work that we've done. This is work that we were able to do through Georgia Halkett sharing so generously the data from one of her studies, where we looked at the levels of patient distress over time and what the supportive care needs were. The critical thing with this graph is really just to recognise that if people have distress at some point, often it just continues to escalate. So the need for us to be able to provide interventions and information is really, really important. And that's particularly related to practical needs and supportive care needs as well. I think the important thing to notice on the graph on the left hand of the slide is really that a lot of those dark lines mean that people's needs are increasing over time. And that's maybe to be expected, but we also can do better at making sure that you get the support that you need. We also know that uncertainty is a really big issue for people living with brain tumour, and that's both from a patient perspective, but also from the carer. So living in that space of uncertainty can be really challenging, but there are things that we can do about that. So the approach that we really took with BRAINS is to have a really comprehensive look at what we needed. So one aspect of this was to really identify a process to screen people so we can work out what needs people have at particular times and tailor referral pathways to provide that support. And we're in the process of, we've developed the screening portals, and now we're in the process of trying to get those implemented and in community-based organisations, but also hospitals, so that we can better support people and direct referrals. We also wanted to look at models of care because that was really important to us as well, knowing that we need to be providing coordinated care and also to be supporting the healthcare professionals who do provide that supportive care, because they're incredibly important and skilled at what they do. We did look at information resources, supportive care interventions, which I'll talk about in a little bit more detail, and then specific interventions for carers. And that kind of loops us back so that we're constantly providing a check-in with how you're going and tailoring the advice that you're getting for particular issues at different times. So in terms of dealing with the uncertainty, we've got the screening and assessment of needs. We've got tailored and timely provision of information, and we also have care planning and psychosocial support. So how we go about identifying needs, we developed this screening portal which allows us to register people and actually screen what your needs are, using as few questions as we can possibly. We know lots of people ask you lots of questions, and we wanted to keep this as simple as possible. And so here are some examples of the kinds of questions that we might ask about. So uncertainty about the future, being informed about your test results, or being able to do the things that you used to do. And we've simplified the response options to make that easier for people to be able to indicate what they might need help with at a particular time. So moving on to the kinds of things that we can provide to support people, we're really talking about emotional, cognitive and physical supports and addressing each symptoms in each of those areas. The Reclaim Life for Brain Cancer is a program that is still in development, but it is intended to support people who are diagnosed at a younger age to actually re-engage after their diagnosis and treatment with work and schooling, education and general relationships, and that is an online and group-based intervention. We've been doing, along with Karen as well and her team, some work looking at personality and behaviour change in adults with brain tumour, and the intention is for us to take that preliminary work that we've done to really start to develop some supports, some information supports and strategies that would allow us to better support people in that space. And that's work being undertaken by Emma McDougall, who's a PhD student at Curtin University. We also had collaborated with Tamara Onsworth, who is a neuropsychologist at the University of Griffith, who developed the MAST intervention, which stands for Making Sense of Brain Tumour. And in the BRAINS program, we took that intervention, which had been delivered in person or by telephone, and delivered it by telephone nationally. And it involves between 6 and 10 sessions, and it can be a patient or a caregiver, or patients and caregivers together, or in fact families who engage in that support. And it's really about understanding the brain tumour, exploring the impact of the existential concerns that people have or are derived from that occur when you've had a brain cancer diagnosis. And we're currently working with different organisations to try and make that more readily available, because we know that some of the challenges are getting to face-to-face appointments. So this kind of telehealth approach can actually be really effective and was very acceptable to people when we tested it. Okay, so we also know that cognitive difficulties are something that many people experience, particularly in terms of changes in concentration and memory difficulties, and word finding as well. So what we did was to work with Karen Pike, who is a neuropsychologist as well, who had developed a program called the Latch Memory intervention. So this is a 6-week memory and skills and strategies intervention. It's delivered as a group program, again via telehealth, so that you have the group interaction, you're not having to travel places to get the intervention. And again, what that showed was that people felt more able to manage their memory challenges than they did before they started the intervention. And we're again, given that this is an effective intervention, trying to find strategies to deliver this in practice. I think Karen highlighted one of the issues in Denmark, and which is reflected in our workforce here, is that we don't have a strong, robust workforce to be delivering these kinds of neuro-oncology interventions more globally or more widely across the country. So we need to increase the number of healthcare professionals who are able to provide that kind of support. We are also really interested in trying to resolve or help people manage some of the physical symptoms that they experience, so in particular fatigue or sleep disturbances and low energy and motivation. So in terms of fatigue, what we've done is taken an intervention that was developed in the UK for general cancer survivors and really done a lot of work to tailor that to make sure that it was suitable and appropriate for people with brain tumour. So we've adapted the cancer-related fatigue online intervention for brain cancer, and what it does is to provide information about the things that you can do yourself to help cope with fatigue. And we're just about to start a randomised controlled trial of the intervention to see whether or not it does actually improve self-efficacy for cancer-related fatigue in people with primary brain tumours. So the study's not quite ready to start yet. We were hoping that we would be able to share a link to all of the information so that you could join, but it's not quite there yet. But I've put Rachel's contact details on the slide. So if you're interested in knowing more about this, then please do feel free to email Rachel or myself or anyone at the POCOG team. And we can provide some more information about that and let you know when it's ready to start as well. And I should just say that the study involves us having a brief phone call with you and then you deciding whether you would take part or not, and then you're randomised to one of two different approaches to this intervention. And what we're hoping it does is actually improves how you feel about managing your fatigue and maybe might also just improve your fatigue levels as well. And we really recognise that fear of cancer recurrence, or in oftentimes in brain tumour it's much more likely to be fear of progression, is something that's really common in people with brain tumour. And that can be something that some people cope with quite well, and other people find it's very intrusive and starts to impact on their ability to live life the way that they would and function as they wish to. And so what we're aiming to do is really take some of the interventions that we've developed again in other tumour groups and really try and make sure that they're suitable for people with brain tumour and tailor that information and those interventions much more effectively. So this is work that's currently in progress at the moment. But I guess if you feel like you are finding the uncertainty a real challenge, then maybe something to do would be to talk to clinical psychologists, particularly psycho-oncology specialists, and ask if they're trained in the conquer fear intervention, because this is something that, while it might not be a perfect fit, it could actually be quite helpful. And some of the tools or skills that we teach as part of that, you might find helpful in your daily lives. So I wanted just to move on now and talk a little bit about some of the work that we've done for carers. And so our colleague Helen Hayden, again with support of Georgia Halkin and Anna Nowak and Thea Blackler, have developed an online intervention for carers of people with brain tumour. And we evaluated this in a pre-post study where people were randomised to the intervention or a waitlist control, so everyone eventually got access to it. And this resource is really the QR code's there, it's live, so please feel free to access it and use it and share it within the community. But the intention was that we covered topics that people had given us feedback on, that they wanted more information and more support. And the topics can be found from a drop-down menu or other, there are multiple ways of accessing it. Some of the things that, the topics that we cover include what's happening for the person with a brain tumour, so whether you're newly diagnosed, starting or finishing treatment, or if you're just needing information and resources about general coping. So that's all covered on the website. There's written information, there are videos, and so it's kind of a mix of different information resources that you can access and use. And then this, you can also just choose the topic that you might be most interested. So whether it's understanding more about brain tumours or caring for yourself as part of that process. And again, just the QR code for that, because it is a really valuable resource that we want people to have. We understand that that the caregivers have really complex individual needs and varying ideas and timeliness about what might be useful information for you at a particular time. So the resource is pretty comprehensive, and it can be really there to help you to feel less isolated and in the caring experience. So that's something that people have described to us as well. So the other resource for carers that I wanted to highlight was some work that another colleague of mine, Rebecca Ladser-Powell's been leading, which again is a more general cancer carer website where there is information for people to access, but it's not brain tumour specific. But Rebecca also has a study which is ongoing. The QR code link to information about that is there as well for you. And that's really aiming to see whether an online cognitive behaviour therapy intervention is helpful in reducing the distress that carers are experiencing. So that is a trial that's running, and if you're interested, you can have a look at that and see whether it might be something that's suitable for you to take part in. So, where to next? We've done a lot of work. A lot of this was really groundwork because we didn't have a huge amount of activity in this area prior to us starting this grant. But we're really focused on now trying to develop interventions to address those symptoms and supportive care needs that people have. So very much we have proposals in to try and evaluate different interventions and approaches to managing sleep disturbance. Again, preparing and managing personality and behaviour changes, looking at physical activity interventions to help with distress, with fatigue, and with the functional impacts of brain tumour. We want to make sure that we're delivering the right treatment or the right care to the right people at the right time. So stepped care models across all of our symptom management strategies are really important to us so that you're getting what you need, but not more than that. But if you have a high level of need, you're getting the support that will help you address that. And also just wanted to acknowledge that we have ongoing work and activity around the brain cancer care coordination space, because again that's fundamental to making sure that we can deliver these interventions appropriately and to the right people at the right time. So just wanted to reiterate that our team, which is across the country, it's been a fantastic collaboration between many organisations, are really committed to making sure that we continue to deliver interventions and support in the most useful way to people living with the disease. And just wanted to acknowledge the vast number of collaborating organisations, including COGNO, who were part of this grant. And thank you very much for having me here.